paramedic as well. Jay and I today are on the med unit. The other guys are on the truck. We go together when there's a med call, so that way there's plenty of us to handle whatever situation we may need. Person that may not be able to stand up, we might have to help them up or pick them up or carry them depending on how sick they are. So we roll with the big crew, and then once we get ready to transport, it's just me and Jay. Maybe if we need another person, we'll take another person. That way we can, handle everything we need to in the back of the squad. So, if at any time while we're talking, if anybody has any question, please raise your hand. We're kind of here open format. If you guys have questions or anything you want to talk about, let us know. In our career, EMT school is what, a 3 or 4 month program? So if you guys are interested in doing that, you go in, you take the course, you get certified. It's a national certification. You can use that pretty much anywhere, and it's some good life skills. It teaches you kind of the basic level, first response care, emergency, and then if you want to advance that, paramedic is a year-long course, and that teaches you a lot more. You can go more in depth. There's drug interventions that you can do, cardiac rhythm analysis, 12-lead analysis. It's basically EMT is kind of your first step into it. Paramedic is a giant step up. A lot of people are interested in becoming PAs or doctors or nurses. Paramedic's actually a really good step for that, because in a 1-year time period you learn just a crazy amount, and then you can go forth from that and become the PA, the doctor, and have a nice base of information for a lot of that. A normal day for us, people ask what our days are like, what our schedule's like. So we work a 24-hour shift. So we get to work at 7 o'clock in the morning. We don't leave until 7 o'clock the next morning. We work, it comes out to 10 days a month. So in a 10-day stretch, we work every other day, and then we get 6 days off. So it works out pretty good. 24-hour shifts can be a little long. Kind of depends on what the shift is like, what our calls are like, what our training is like. But we eat at the station, we work out at the station, we sleep there. Just like normal, it's just that we get interrupted with calls throughout our day. So on a normal day, we get to work. This morning we got to work. We go through all of our equipment. We go through all of our boxes. We make sure all of our meds are in order. We make sure our cardiac monitor is working. We check everything, every single, down to the little bandages, to make sure we have everything, because we never really know what the next call is going to hold. The truck crew does the same thing. They go through all their saws, they start everything up, they go through their equipment, they make sure everything is accounted for. That way, if we were to pop a fire call or a medic run, we're ready to go for anything that could possibly come up. After we do our morning checks, we have chores. We do chores just like you guys do at home. We have to keep our station clean. We have kind of a list set up of days that we go through different chores. Get those done. We'll usually do some training. We try and do about an hour of classroom training and an hour of hands-on training every day. So whether we sit in the classroom and we go through fire tactics, or we go through some medical training, kind of brush up on some skills that we don't use very often, so if we do get that call, we're ready to go. And then later in the day, we'll do some kind of hands-on training, whether we get the equipment out and play with it, or we go out in the bays and pull some hose around, or whatever you guys can think of. Do a workout, and then usually it's dinner time. After dinner time, we all kind of have our own time, whether we sit together and watch a movie or play a board game, or whatever trouble we decide to get into. We go to bed. We have a normal, I don't know if it's official bedtime, but everybody kind of retires around 9 o'clock. That way, if we do get a call during the night, at least we got some sleep. Again, that schedule that I laid out is constantly interrupted by calls. Whether we're, like right here as we're standing here, we could get a call at any time. Our other medic unit, Medic 1, is going to cover our first call. So these guys will go, and Jay and I will stay. If there's a second one after that, Jay and I will go on that call. So, our day, we kind of start the day with a schedule, but that schedule changes and is really fluid throughout the day, because we never know what's going to happen, who's going to call us, and what we're going to have to respond to. Questions so far? Anybody?
Is anybody interested in being an EMT or firefighter?
Couple? Awesome. Good. It's a great career. It's really rewarding. It takes a little bit to get into it. I know most of us have volunteered at some point in our life for a volunteer fire department. You know, and tested for numerous fire departments to get a paid job. And it does take a little bit of work, but once you're there, it's really rewarding. You know, I think I speak for all of us when I say I wake up every day excited to come to work, ready to come to work. At the end of my 6 days off, I'm always ready to get back to work. You know, you can only have so many days not doing anything. So we brought some of our equipment here. Our gray box here is full of all of our basic level stuff. It's got our, we call it our airway box. So it's got our blood pressure cuff and our pulse ox, so we can check their pulse rate, we can check their blood pressure, we can check their blood sugar, which is really important if somebody's altered or acting funny. We make sure it's not a blood sugar problem. And then it's got all of our airway stuff. So if somebody's having a little bit of trouble breathing, we can give them an albuterol treatment, we can give them some oxygen. If they're having a lot of trouble breathing or they're not breathing, we can use our bag valve mask to breathe for them. We actually carry an intubation kit in there where we can put a tube into them and breathe for them that way. So, you know, that's the thing with our job. There's kind of a scale of from least critical to most critical. So we can start off with the basic, you know, put a mask on them, put a nasal cannula on them, and then as we go along, we can go further and further down that until they're, you know, intubated and we're breathing for them using a bag. That's pretty much that box. We carry some of our trauma dressings and stuff in there, tourniquets for something that's bleeding really bad. We can tourniquet that limb and take the bleeding away, but it's a little more invasive. Orange box has our medications in it. So this is kind of our ALS box. ALS stands for Advanced Life Support. That would be more of a BLS, a Basic Life Support. So this has all of our medications that we would use. We carry quite a few meds. We can do everything from, you know, treat an allergic reaction. Anybody have an EpiPen or seen an EpiPen? So we don't carry an EpiPen. We just carry a vial of epinephrine. It's the same drug. It's just in a vial. We have to draw it up. So we can control an allergic reaction. We also carry some Benadryl. It's IV Benadryl, so it acts a lot faster. If somebody's heart rate is way too fast, we can slow it down. If their heart rate's way too slow, we can speed it up. We start an IV and we can give these meds that way. And then there's a bunch of drugs that we use for what we call a Code 99. A Code 99 is a CPR in progress call. Anybody here is CPR certified? Taking a lifeguard course, taking a babysitter CPR course? No? Okay. So for any call that we're doing CPR, obviously that's going to be a very critical call. There's a lot of interventions that we're going to do. You know, we're going to analyze their heart rhythm. If their heart rhythm indicates they need to be defibrillated or shocked, we're going to shock. We're going to have CPR going. We're going to have them intubated. We're going to have either an IV line or an IO line. Anybody know what an IO is? It stands for interosseous. So, when somebody is having CPR done to them, do they have a blood pressure? If we're doing CPR, their heart's not beating or not beating correctly, right? So if we're doing CPR, they don't have a blood pressure. If they don't have pressure in their veins, are their veins going to be nice and expanded like our veins normally are? They're going to be kind of flat, right? So it's going to be hard for us to get in and start an IV, which stands for intravenous line. So we have what they call an IO. It's a small drill, and it comes with these. They look almost like a drill bit. These are actually a needle. So we can actually put drugs directly into the bone marrow by drilling into the bone. Now it sounds really, really invasive, and it is. This is last ditch. We've looked for an IV, we can't have one, and this person needs those drugs to save their life. We can actually drill into the bone until we get to the marrow, and then we can give our drugs that way. So like I said, sometimes, you know, we have skills that we don't use every day. This is one of them. We might not do an IO for a couple of months, and then all of a sudden you get a call, you have to do one, you need to know exactly how to do it, and you need to know how to do it right. So that's why we do so much training. Any questions so far? All right.
It's first hour.
Yeah,
First.
like
First.
this every day.
Everybody's still asleep. Perfect. What else can we do have our cardiac monitor. We have kind of a cool device on here that is new. We just got these monitors a couple months ago. So we can, check our blood pressures, we can hook somebody up to an EKG, see what their heart is doing. We can monitor how much oxygen is floating around in their blood. We can put a nasal cannula in them, and as they breathe, we can actually monitor how much CO2 and oxygen is in their breath as they exhale. We can tell if their cells are perfusing. We can make sure that they're breathing adequately. If they're breathing too fast or too slow, we can actually find that out through here. One cool device that we have is called a QCPR puck. So what this does, I'm going to try and do it here. This actually monitors our CPR. So as we're doing CPR to somebody, we're going to be compressing, right? So as I compress, that's about the rate and the depth that I want.
Without sign of compression.
If I use this, if you guys watch on here, it will actually show my CPR. So see right here? If I start doing this too weak, that line doesn't hit both sides, right? So if I'm not doing this good enough,
pressure between
it's
compression.
going to start coaching me. It's going to start telling me that I'm not letting off enough. I'm not pushing hard enough. So, and it has a little display here that shows us as we're going, how deep we're going, how fast we're going. Technology that's come along with CPR is really, really advanced, and it's pretty cool. It makes our jobs a little bit easier.
15 seconds.
Turn that off before it tells me that I'm not doing CPR. Another thing that we have is called a Lucas device. So standing over the top and pushing takes a lot of energy. We have to switch off people doing it. That ties up 2 people. So, if we were to run a code right now and I were in charge, I would put Twiggy in charge of getting an IV or an IO. I'd put Jay in charge of airway. I'd probably put Captain on drugs, so he would be getting all the drugs ready, everything ready. I'd be watching the cardiac monitor. I'd be taking care of all the shots. Phil would be running back and forth through the squad like a madman, making sure that I have all the equipment that I need. If we're doing CPR on somebody, not only do we have to do the CPR and breathe for the person and give them medications, we also have to pick them up and move them out of the bedroom or the bathroom or wherever they happen to be and get them out to our squad. So there's a lot of hands involved in CPR. Plus, if we didn't have this machine, we'd have to have 2 more people switching off every 2 minutes to make sure they're doing good CPR. So, right there, you're already up to 6 people. This machine is called a Lucas device. It basically takes the place of us doing compressions, and it will do compressions for us. So we put this on, put that board underneath the person, clip that in, and then you guys will see once they get it running that this machine is actually going to do compressions for us. It does them at a rate of 100 times a minute. It senses the depth of the chest, and it actually does the perfect amount every time. It's really efficient. It's electric. The battery on this will run for anywhere between about 20 and 35 minutes, and it'll run continuous. So go ahead and start it. So that's going to run, we can either set it to 30 to 2, or we can set it to continuous. If we have a tube in them, if we've intubated them, we have a tube inside their trachea, we can breathe continuously. If we don't have that, we have to set it to 30 to 2 so that it will stop compressing, so we can give a couple of breaths and get some oxygen into their lungs. So, like I said, it saves a lot of time. It saves a lot of energy. Usually, especially if we now move this in the back of a squad and we go to the hospital, lights and sirens, we're going to be driving pretty fast. It's easy to lose your balance in the back of the squad or get to where you're moving around, and it's hard to keep those compressions going. That machine really makes it pretty easy.
Those look up the heart monitor again. Those are really specialized pieces of equipment. Both of those cost as much as a car. That one right there costs as much as a really nice car. They're super specialized pieces of equipment. When you get into these types of job fields, you'll be working with portable, multi kinda take it for granted, but there's a lot of technology and cost in a lot of these jobs.
Yeah, and these ones especially, you know, being new, we can do something as simple as check and see if there's oxygen in your blood or how much, or we can put 4 leads on and see the electrical activity in your heart. If we want, we can put a full array of what we call a 12 lead. It has a bunch of different sensors that we put on all the way around your heart. And we can actually take a sectional image, so we can look and see what each part of the heart is doing. And by analyzing those electrical rhythms, we can actually tell if somebody's having a heart attack, if they're having an arrhythmia. We can sense damage to the heart, so if they've had a prior heart attack, we might not see that they're having one, but we can see that they have prior damage going on. If their heart is going too fast, we can cardiovert it. You know, if the heart is beating so fast that it can't pump blood, we can actually administer a small shock, and that causes the heart muscle to tense up, and then it'll relax, and then it'll start beating normal again, so it'll slow that rate back down. Or if we need to, the opposite. If the heart is beating too slow, and the drugs that we carry that normally speed a heart rhythm up aren't working, we can do what we call PACE. And a PACE is exactly like it sounds. It's like a pacemaker. So a pacemaker administers a small shock inside the heart that causes it to beat in a rhythm. We can do that from the outside. We put our 2 pads on and we administer a small shock, and it will cause the heart to beat. So if somebody's heart's beating 30 times a minute and their blood pressure is really bad and their skin color looks bad, we can turn that up slowly and actually get their heart to beat up to 70 or 80 times a minute. It's not the most comfortable thing in the world. They're getting shocked 80 times a minute, but you know, if it's a life-saving procedure, that's something that we need to do. Questions, comments, anything so far? Yeah.
So like, how many calls do you get a day?
Good question. We, on average, the whole department gets what, probably 12, 10 a day?
Yeah, 3,800 divided by 365.
Yeah, we had 3,800 calls last year per our 4 stations. In Papillion, there's 2 stations, and then in La Vista, there's 2 stations. And Papillion Fire Department covers all 4 of those. There's 2 med units, 3 apparatus, so there's 2 trucks and 1 engine. And then there's a battalion chief, and he will go to our more critical calls. So it varies. Some days we get 2 calls, some days we get 12 calls. It just, you know, depends on the day, depends on who decides to call 911 that day. And probably anything you can think of, we've been to. You know, people call 911 for, I got a little cut on my finger, you know, pretty much anything you can think. Yeah.
Do you ever feel that just stuff like that, where I've got a little cut on my finger, it feels like a little excessive if you send like a whole truck there or something? Do you ever?
It can be, but like I said, it's hard to know before we get there. Take that call for an example. You know, somebody calls us for a cut on the finger, we see the dispatch, we go. We get there, come to find out, not only do they have a little cut on their finger, they have a little cut on their finger because they fell and they hit their head and they're on blood thinners and they're acting kind of funny and their blood pressure's super high. So now we're starting to think, okay, maybe on top of that cut finger that's probably not going to stop bleeding because they have a blood thinner, maybe there's something else going on. So we always do. Sometimes it's as simple as, you know, we'll get there as a med unit and we'll say, oh, you know, we got this, and we can tell the truck to, you know, pull off or come in without lights and sirens just in case we need them. You know, I think we've all been caught there where we get called for something that sounds really mundane, you know, a nosebleed. Come to find out it's a lot more serious than that, you know, something, or, you know, bit their lip and bleeding. Well, come to find out they didn't bite their lip, they're not bleeding, they're coughing up blood. So, you know, it's sometimes calls change like that. So we always do run with a full crew. You know, you never know what we're gonna run into or who we're gonna run into. Good question though. Any other questions?
You gonna break them up into some skill groups?
Sure, we can do that.
Blood pressure, lung sounds, pulse ox, and then each monitor.
Perfect.
Yeah.
Let's go, gonna go half, maybe?
We get 3, it's a lot for half. 3 stations?
Yeah, Yeah, we can do 3 stations. Let's do